The peak relational training system. A single subject, across skills, multiple baseline design look at the effectiveness of the peak program on specified skill acquisition. The Peak Relational Training System was created by Dr. Mark Dixon of Southern Illinois University in Carbondale, Illinois. It is a system that focuses on contingency-based or directly trained learning. What does that mean? Well, it's one of the simplest learning processes. All questions and answers are taught individually. Correct responses are reinforced or increased by feedback from the instructor following the response. It requires few prerequisite academic skills, which is one of the reasons why this particular system has such vast utility with populations with cognitive and behavioral disabilities. What it does require is an association of specific question to specific answer. When speaking of the peak relational training system, there are also environment and stimuli considerations. The environment needs to be free of distracting stimuli, such as huge distractors like a movie playing in the room or extremely loud noise. Also, the instructor must be able to maintain control of the stimuli. All needed materials need to be on hand, as well as the instructor having an ability to restrict access to feedback and reinforcing items. The peak relational training system is quite individualized. Consider the developmental age of the participant or participants. Consider the sensory and functioning level of the participant. Consider the relevance of the items you choose to use to the life and natural environment of the participant. Now, here's a warning. Be careful with those reinforcers. As stated earlier, reinforcers and feedback are critical components to the peak relational training system. So you need to make sure that you select reinforcers that are preferred. There are multiple ways to assess preferences and reinforcer strength using preference assessments. Preference assessments can be done informally, like by observing the participant engaging with materials and items in their natural environment, or even talking to family, friends, nurses, teachers, and those personnel that interact regularly with that participant and may be able to give good, solid information as to what items or rewards are particularly reinforcing to that participant. Preference assessments can also be done in a formal manner. Just to name a few: paired stimulus, free operant, multiple stimulus without replacement, and there are many more. Reinforcers must be specific and functional to the participant. They need to be easy and quick to deliver. Edibles, small edibles, can be very good for this. The reinforcers need to be immediately usable or entirely consumable. They need to be accessible only through the instructor. Of course, if the participant has free and open access to the reinforcers throughout the session and even outside of the session, it can diminish the reinforcing effect of those items. Which leads to the next one: unlikely to create satiation, abuse, or fatigue. And if you find yourself after going through all of this and you can't find an effective reinforcer, escape. Yes, escape. Not run away, but escape. Taking a break can be quite an effective reinforcer in sessions. So you engage with the participant, you run the program, you give a break. Run the program, you give a break. That constitutes being able to escape from the task, which can be very reinforcing. And now for the present study. The participants. The subject was a 7-year-old female with characteristics of attention deficit disorder, but not formally diagnosed. The researcher was a Southern Illinois University behavior analysis and therapy graduate student. The setting and apparatus. The setting was in a room in the child's residence in Carbondale, Illinois. The apparatus used was the Peak Relational Training System Direct Training Module. The design was a single subject, across skills, multiple baseline design. And now for the procedure. The first step in the procedure was the direct training assessment. This can be done directly or indirectly. The PEAK assessment contains a 184-item checklist that instructors and caregivers can fill out to indicate if they have observed the presence of each specified skill of the PEAK module. The other way that the direct training assessment can be conducted is to simply run the actual program to see if mastery is present for that particular skill. In the context of the present study, the results of that assessment would be our baseline data. From there, the results of the assessment can be used to fill out the performance matrix triangle, which is a visual organization by color of the assessment results. Anything that is not colored in or any programs that have not attained mastery are open to being selected for program selection. Gather and have readily accessible the items for reinforcement and program implementation. Then getting the baseline data that was mentioned earlier, running the program without feedback. And finally, the instructions. The instruction portion of the assessment. Using discrete trial training or DTT. Discrete trial training or DTT breaks down questions, presenting them one at a time and only one time per trial or before each prompt delivery if necessary. Feedback and reinforcement are given immediately upon correct response, and we provide prompts according to prompt hierarchy of least to most intrusive and record those responses according to the prompt-informed PEAK data collection system. Now to present the results of the present study. A multiple baseline design across skills was performed in the current study. 3 programs were chosen. Each graph correlates with each program. The first graph, intraverbal phrases, 10I. The second graph, receptively labeling planets, 10H. And the third graph, intraverbal personal information, 8I. If you look at the baseline data for all 3 programs, you see that baseline performance was well below mastery criteria for all 3. Baseline performance for program 2 and 3 not only was below criteria, but showed a declining trend. If you look at the first program, mastery was attained at trial block 7. Again, mastery criteria was 3 consecutive trials of 95% or higher. The second program, mastery was gotten at trial block 5. In spite of the low performance in baseline and the declining trend in baseline, you see a sharp increase in performance at trial block 1 if you look at the second graph. This was not due to any particularly confounding variables, but rather due to it being a receptive task out of an array of 3 or more. A lot of good guesses were able to be made. In fact, the participant openly admitted that she didn't know the answers, but that she was making lots of good guesses, and because of those good guesses, she was able to do a process of elimination to get correct answers. Now looking at the final graph, intraverbal personal information, 8I. Again, you see a declining trend in baseline. Then you see a sharp increase in performance in trial block 1. This was not attributable, at least not obviously attributable, to any other confounding variables either. Mastery criteria was never officially met in this particular program. If you look at the last 3 data points, 2 rather than 3 of those last 3 data points meet the criteria for mastery. 2 of them are at 98%, and the final one is at 94%. The program was cut off at this point due to consistent and persistent interference with behaviors associated with ADHD, ADD. The particular participant was having a hard time responding correctly to the same exact questions over and over again without showing any improvement. Additionally, the performance that had been done at 98%, 98%, and then 94% was rather close to criteria. So all things considering, the program was cut off at that point. And now for the discussion portion of the present study. To begin with implications. The peak assessment procedure was effective in facilitating the acquisition of specific skills or targeted stimuli that have yet to be mastered. Thus, this study is one that should be replicated with a greater quantity of subjects, other populations, etc., to increase or further establish the validity and effectiveness of the peak relational training system. Limitations. ADHD, ADD. The subject's high level of distractibility appeared to make it especially difficult to acquire some of the stimuli or targets and retain them, even when those targets were presented multiple times within a single trial block. She did notably better with numbers than she did with words. This significantly impacted her ability to meet criteria or respond consistently without prompting to certain individual targets. Future research. Include a generalization probe for each program implemented. Compare peak performance of typically developing children with and without ADHD. One of the things that was interesting about our particular participant was that even though there were no distractors in the room, no loud noises, no television, movies playing, things of that nature, in spite of all of those things being controlled, the ADHD, ADD characteristics displayed by the particular participant meant that she got distracted simply by sitting there. Lots of fidgeting in spite of being prompted to be still or being reinforced for being still. Lots of playing with clothing, things of that nature. It would be interesting to see if peak performance of typically developing children with and without ADHD would dramatically differ, or if some of the fidgeting might be more age appropriate than we think. Finally, compare speed of skill acquisition defined by mastery criteria when using peak versus other learning or academic skill acquisition methodologies. I hope we get to see one day exactly how well does peak measure up to the other things that are out there for the same purpose.